Comprehensive Guide to Tennis Elbow. The video is created by Dr. Abhinav Gupta and team. In this video we have covered everything about the topic from initiation to the end. Tennis elbow, also known as lateral epicondylitis, is a condition that affects the tendons in your elbow. It typically occurs due to repetitive motions or gripping activities that strain the tendons in your forearm. While it's called tennis elbow, you don't have to be a tennis player to develop it. Now, let's talk about the causes of tennis elbow. As I mentioned earlier, it's primarily caused by repetitive motions and overuse of the forearm muscles. Activities such as playing tennis, painting, typing, or even lifting heavy objects can lead to the development of this condition. It's important to note that anyone can experience tennis elbow, regardless of their age or fitness level. Several contributing factors can increase the risk of developing tennis elbow. These factors include poor technique during activities that involve repetitive forearm movements, inadequate warm-up exercises, using equipment that is too heavy, or even having improper form while performing certain tasks. Now, let's dive into the pathophysiology of tennis elbow along with its stages. Tennis elbow typically involves inflammation and micro tears in the tendons that connect the forearm muscles to the bony prominence on the outside of the elbow. Over time, if left untreated, these micro tears can lead to the formation of scar tissue, causing further pain and discomfort. In terms of stages, tennis elbow is generally classified into three phases: acute, subacute, and chronic. The acute phase is characterized by the initial onset of pain and inflammation. The subacute phase involves ongoing pain and difficulty with certain movements. Lastly, the chronic phase is marked by persistent pain and potential weakness in the affected arm. Clinical tests for tennis elbow. Cousins test. To perform this test, you would ask the person to fully extend their arm and make a fist. Then, you can apply resistance on the top of their hand while they try to lift their wrist upwards against the resistance. Pain or weakness during this movement may indicate tennis elbow. Another clinical test is Mills test. For this test, you would ask the person to extend their arm and flex their wrist downwards while you apply resistance. If this causes pain over the lateral epicondyl, the bony prominence on the outside of the elbow, it could be a sign of tennis elbow. Treatment. Acupuncture. This traditional Chinese medicine technique involves inserting thin needles into specific points on the body to promote healing and alleviate pain. Some people find it helpful for tennis elbow. Extracorporeal shock wave therapy, ESWT. ESWT uses high-energy sound waves to stimulate healing in damaged tissues. It's a non-invasive procedure that may help reduce pain and improve function. Platelet-rich plasma, PRP, injections. PRP therapy involves injecting a concentrated solution of platelets from your own blood into the affected area. This is believed to promote tissue repair and reduce inflammation. Topical treatments. Certain creams and gels containing anti-inflammatory ingredients like capsaicin. Non-steroidal anti-inflammatory drugs, NSAIDs, may provide temporary relief from pain and inflammation. Braces or splints. Wearing a forearm brace or splint can help support the affected area, relieve strain, and promote healing. It's important to find the right type and fit for your specific needs. Physiotherapy management. Day 1. Start with a gentle warm-up, such as wrist rotations, shoulder rolls, and neck stretches. Perform a few sets of wrist extensor stretches. Hold each stretch for about 20 to 30 seconds, repeating 3 to 4 times. Ice the affected area for about 15 minutes to reduce inflammation and swelling. Take breaks throughout the day to rest and avoid overuse of the affected arm. Day 2. Begin with a warm-up similar to day 1. Try some gentle range of motion exercises for the elbow joint, such as flexion and extension movements. Use a tennis elbow brace or strap while performing activities that may strain the affected area. Apply heat therapy for about 15 to 20 minutes to promote blood circulation and relax the muscles. Day 3. Warm up with the same routine as day 1. Gradually introduce strengthening exercises, such as wrist curls and wrist extensions using resistance bands or light weights. Perform 2 to 3 sets of 10 to 15 repetitions for each exercise. Apply ice or cold therapy after the exercises to minimize any potential swelling or discomfort. Day 4. Warm up with your usual routine. Focus on eccentric exercises, such as reverse wrist curls, to target the muscles and tendons involved in tennis elbow. Incorporate a few stability and balance exercises, like single leg stands or wobble board exercises, to improve overall joint stability. Remember to rest and ice the affected area after your workout. Day 5 onwards. Warm up as usual. Continue with strengthening exercises, gradually increasing the resistance or weight used. Consider adding forearm stretches and myofascial release techniques, like foam rolling, to release any tightness or adhesions in the muscles. Apply heat therapy after the exercises to relax the muscles. Remember to adjust the intensity of exercises as needed. It's important to progress gradually and avoid overexertion. If patient experience any increased pain or discomfort. Vote of thanks. Thank you for watching our video. We hope this information has been valuable to you. If you have any further questions or concerns, please consult our team for personalized advice.